All right, everybody. This is Professor Mack, and I'm here to give you a little orientation to the SiSBAR, meaning Student Instructor SBAR. SBAR standing for Situation, Background, Assessment, and Recommendation. If you can follow my mouse, it's pretty point blank. You've got the date here. You've got your admitting diagnosis. You please do not put your RN's name there, but maybe if you'd like to put the initials there. Who is the patient? Initials again, age, admit date, allergies, attending MD, initials as well. Consults, meaning does the patient have a consult with a pulmonologist, cardiologist, a gastroenterologist? Um, Again, initials, all right. Scheduled medications or PRN meds, course of illness and hospitalization, that's pretty point blank. Ladies and gentlemen, VS stands for vital signs. Time you took the vital signs: T, temperature; P for pulse; R for respirations; BP for blood pressure. What was the pain level? O2 saturation, and everything here is pretty repetitive. Activity level: are they ad lib? BRP standing for bathroom privileges; BR for bed rest. Moving on to neuro, let's go down here. Are they awake, asleep? Level of consciousness: are they oriented? Are they awake, alert, oriented times 1, 2, 3, or 4? What does memory look like? Pupils: are they pinpoint all the way to dilated? Is there a difference in pupils? Motor, sensory. Um, what do their motor sensory functions look like? Are their extremities strong? Can they squeeze your hands equally on both upper and lower extremities? Um, Sedation, analgesia, and anesthesia history. That's for any of our patients that are post-op. Moving on to cardiac, HR, heart rate. You also have rhythm. You've got pulses. You can get a temporal pulse if you're real good. You've got carotid pulses. You've got brachial pulses, radial pulses, popliteal, femoral, posttibial, dorsalis pedis. What is the pulse quality? Are they bounding? Is it weak or thready? Is there a pulse deficit? Pulse deficit means any differences that you might find with the apical pulse and your peripheral pulse. What does the skin color look like? Cap refill, is it less than 3 seconds, greater than 3 seconds? Any edema? Where's the location of that edema? IV sites, IV solutions, rate number 1, number 2. PCA drug. PCA is patient-controlled analgesic drug. This is something that they press, and sometimes when they program this machine, there's always there can be a continuous rate. There can also be a bolus, right? Let's say, oh my goodness, what happened here? Let's put it back on view. Boom. All right, there we go. So you can have a bolus every, let's say if it's morphine, a bolus of 1 milligram every 15 minutes. Um, are they on total parenteral nutrition at um, lipids every day at what time? What time? Okay, pulmonary, respiratory rate, quality, breath sounds, O2 delivery at how fast? 2 liters per minute, all the way to 10 liters per minute. Is the patient on room air? They on NC, nasal cannula? Are they on a mask, or do they have a trach, or are they on a ventilator? Um, Moving over here to GI, we've got diet, regular. CL stands for clear liquid. FL stands for full liquid. Then you've got bland diet. You've got ADA diet, American Diabetic Association diet, low sodium, cardiac diet. Are they on any fluid restrictions? Do they have any nutritional supplements? What percent of oral intake did they have with breakfast? Could it be 25%, 0%, 100%, lunch or dinner? NV, is there any degree of nausea or vomiting going on? Abdomen, is it tender? Is it round and soft? Were there any bowel sounds? Times 4. Was there a quadrant that had absent bowel sounds? Still characteristics. Was it brown, black, formed? Did the patient have diarrhea? loose. You all know those descriptions. GU standing for genitourinary. You've got I's and O's, urinary, fully output, um, every 4 hours, 8 hours, 12 hours. Intake, PO, intake IV. So you've got your bedpan. Um, how many times did they use it? Did they have any urine? What was the color and characteristic of the urine? Is there a dialysis access site? Could it be a fistula or is it a Quentin catheter? I want you all to look that up. All right. Skin. What did the color look like? What did the turgor look like? Was there any tenting going on or no tenting? Temperature. Was the skin warm to touch or was it cool to touch? Were there any lesions, rashes, pressure ulcers, dressings, incisions? Okay, moving down to labs and diagnostics. You've got a CBC or complete blood count, hemoglobin, hematocrit, white blood count, platelet. We talked about platelets last time. You've got a complete metabolic panel. You've got sodium, potassium, chloride, uh, carbon dioxide, BUN, creatinine. UA stands for urinalysis. BLD cultures, blood cultures. Are there any other pertinent labs, diagnostic studies? Psychosocial, spiritual? What does their psychosocial capacity look like? Are they, are they not talking to anybody? Do they have a strong spiritual base? Do they have a chaplain that they rely on? Do they have a prayer life? Nursing, diagnosis, plan, summary of the care provided. All right, I think that's it in a nutshell. I hope that this made sense. If you have any more questions, please shoot me an email, as some of you have, and um, hopefully you guys will be using this to report to your clinical instructors. Once again, I hope this is meaningful to everybody. And if you do have any questions about clarification, please shoot me an email or go ahead and ask your clinical instructors. They will give you some clarification on this. As you know, I trust them and they're very knowledgeable with this. So hope this will suffice. Thank you guys and God bless.